When it comes time to ask a question, I'll ask you to raise your hand. And so how you'll do that is click on the participants icon in your app or on your screen, and then click the little hand icon. That will let me know that you would like to ask a question. But as I mentioned, we'll go ahead and share some information first, and then we'll take questions here in a little bit. So with that, I would love to introduce our speakers that we have today. We have Randy Kuykendall of Colorado Department of Public Health and Environment, and he's the Director of the Health Facilities and Emergency Management Services Division. And we also have with us Dr. Jeff Beckman, and he's the Medical Director and Associate Division Director of the Emergency Management, or sorry, the Health Facilities and EMS Division. So with that, I'll hand it over to Randy to get us started.
All right, thank you very much, Mariah. I appreciate it, and very much appreciate everyone who is attending this morning to share some information and bring folks up to date on where our division is and the role that we play in terms of dealing with the pandemic. For those who may not be aware, the Health Facilities and EMS Division is responsible for the oversight, licensing, and certification for all of Colorado's healthcare facilities, of which there are a little over 3,300 across the state. So it's hospitals, nursing homes, assisted livings, and facilities of that nature. We are also responsible for the oversight, some funding, and certification of Colorado's 18,000 emergency medical services providers that make up our part of our first response system. I want to just perhaps start off, first of all, of giving everyone a little bit of some of the background of what's been going on. I just want to say right up front that the 45 years that I've spent in healthcare, I have never seen a time where we were facing the kinds of issues that we're facing with this particular pandemic. And so this has been, continues to be a learning experience as we all move forward, working as hard as we can to mitigate the spread of COVID-19. You'll see on the slide there, January through March, as I said, our normal work at Health Facilities and EMS is that we inspect and oversee and regulate, if you will, both from a licensing perspective, so that's a state function, as well as we represent the Centers for Medicare and Medicaid Services in terms of ensuring that facilities meet CMS guidelines to serve Medicare and Medicaid clients. So we perform routine inspections and follow up on complaint investigations and enforce rules and regulations from that perspective as well. We work very closely with our healthcare community across the state of Colorado to ensure that the highest quality care is provided to Coloradans. And then as we started to see the jump in COVID-19 and its spread, particularly as it came to the West Coast, we began preparing and beginning to shift. And in early March, it became very clear to us that it was going to be time for us to make a shift in our focus moving forward. And again, as I said, we all know this is a novel virus, so it's something that we have never seen before, and we're learning about every day. So beginning in mid-March, the Centers for Medicare and Medicaid Services did issue orders for all of the state agencies, such as ours, to stop our routine inspections and investigations and shift specifically to inspections around infection control. Now, facilities are inspected for infection control on a regular basis, but this was a shift from CMS to particularly focus on infection control and some of the new processes that were going to be implemented as a result of the advent of COVID-19. We also began to limit our investigations only to the high-level complaints, meaning immediate jeopardy, which in our world really is talking about those situations where life and limb are at stake. And so those complaint responses have continued as we got into March and then into late April. At the same time, I think it's important to note that we all made shifts in terms of the manner in which we were doing our inspections with regard to protective equipment, our PPE, and our protocols moving forward. And then since that particular point in time, we have continued operating in that fashion, performing infection control checks. Virtually every single nursing home of the 232 nursing homes in Colorado have received at least one infection control check. We are circling back to some of those as we're trying to work with facilities to mitigate spread. And then we are continuing forward with our infection control checks of the approximately 800 plus alternative care type facilities that we oversee. Go ahead and go to the next slide, please. And so I'll talk a little bit about Public Health Order 2020, which currently is still presently in effect. I think that's an important distinction to make. And the Public Health Order 2020 restricted, that was the order that restricted visitation to our facilities, and that applies to nursing facilities, assisted living residences, intermediate care facilities, and group homes. And so those were put in place, became part of our infection control surveys as we move forward, providing information in support of that effort, because it became very clear early on, as we all know in this process, that our vulnerable populations in these facilities are at a special risk in terms of the severity in which they suffer from this disease. There was a revision of Public Health Order 2020 on April 20th that added to it an isolation plan submission that was required for all of these facilities. Now that's a little over 1,000 facilities in the state of Colorado. I think it's important to note that we have received virtually all of those facility isolation plans. So everyone has been compliant. The department continues to work through those plans to identify areas where maybe we can be of assistance and help facilities improve on the plans that they have. And those things continue at this point in time. I would also point out that during this period of time, I think we all appreciate and understand that the shortage of personal protective equipment became not only an issue for our facilities, but for our agency as well, as we have continued to work through those. So we'll go ahead and go to the next slide, please. You know, just to think about some of the challenges, you know, Jeff, I would ask Dr. Beckman to want to talk a little bit about some of these issues here from more of your perspective, please.
Thanks, Randy. So really, it was early on that we identified that our residential care community, older adults, certainly are most risk and most vulnerable to this disease, as Randy had alluded to before. And with the infection control best practices that we provided technical assistance for, also, we wanted to ensure that both providers and residents had appropriate personal protective equipment. So with that, masks are certainly a very important part of that, in addition to gowns, gloves, and eye protection for our providers who are providing a level of care. Also, another thing that came of this is we did identify that there is risk of transmission from asymptomatic persons. And that certainly made it really important to identify all staff coming in to the facilities to make sure that we could early identify folks that had illness but had demonstrated no symptoms, as there was certainly a risk for asymptomatic transition. So part of those efforts were to test staff and make sure that we could determine a person that had risk for transmission but was not demonstrating symptoms. So we did utilize National Guard and other services to help test and identify those folks. And really, you know, again, as Randy alluded to, this was a very novel disease, and working with our local public health agencies, getting direction from our state epidemiology team was really paramount and helping us really intervene as best practices to make the most effect for the greatest number of this population. And then also we know that there is, certainly a balance between visiting restrictions and certainly maximizing protection for residents so they don't succumb to the illness. And really that has been a strong desire as we try to balance both the residents' mental health and ensuring levels of connectivity, but also maximizing the protection for their medical health and reducing exposure and transmission of COVID-19. So next slide, please.
So this is Randy. I'll go ahead and address some of these points here as well. And talking about the residential outbreak task force, and it's been called a variety of things over the past month or so, but regardless of which way we refer to it, this has been a group that has become really a focal point and key, I think, to our continuing to move forward to mitigate the spread of COVID-19 across our residential care facilities. This group was established in late April. The governor saw fit to pull a group together that focused specifically on our residential care facilities here in Colorado. As I said, that's over 1,000 facilities and certainly impacts many thousand individuals who live and work in these facilities. So this group was pulled together to focus specifically on just residential care facilities and the work that needs to be done there in mitigating the spread, because it became very clear early on that a disproportionate number of deaths occur in these facilities as a result of the comorbidities. These are that many of these residents live with. They are vulnerable to this disease as well as others. And our goal in the group is to mitigate the spread of COVID-19 in all high density environments that serve older adults, as opposed to other high density facilities that our emergency operations center and our epidemiology folks are focusing on as well. The group is made up of representatives from the Colorado Department of Public Health, the Department of Healthcare Policy and Financing, and the Department of Regulatory Agencies, as well as a number of subject matter experts in epidemiology. Folks like Dr. Beckman here with me that are going to bring the science part of the component to the table. I'm privileged to co-chair this group with Ms. Bonnie Silva from the Department of Healthcare Policy and Financing. And so that group literally meets daily and began to start to pull the science together in how to best address mitigating the spread across our residential facilities. Now the next slide, please. So the task force, as it came together, developed the strategies that you'll see on the slide there in front of you. I think of those as the foundation or the pillars of our strategy in trying to mitigate and eliminate the spread in these facilities with proactive and reactive monitoring and testing. We'll talk about that a little bit more, I think, moving forward about testing and how important that is. As you noted, Dr. Beckman alluded to the asymptomatic carriers, which is really one of the things that makes this very different disease to deal with than many of the others. We have increased and improved our infection control and enforcement efforts. As I said earlier, the health facilities and EMS division, we have visited every nursing facility and are working our way presently through the other facility types to provide infection control oversight and provide education. The use of personal protective equipment, PPE, in the long-term care environment is not a regular activity as it might be in our acute care environments like hospitals and surgical centers and things like that. So there's some education. As a matter of fact, there's a lot of education that's been required to train the staff members and caregivers in how to actually use that equipment, in addition to, of course, the ongoing difficulties that we've all experienced in obtaining sufficient levels of PPE. that are out there. And then working with facilities as we have learned more about this disease and the separation and isolation of residents wherever possible that are positive for COVID-19 versus those that are not, to slow down that spread. And then obviously an area that we are all extremely concerned with and we watch very carefully along with the providers is to stabilize the staffing in facilities, because staff are certainly susceptible as well. And we have had facilities where additional staffing, we have identified additional staffing to supplement facilities as they get through an illness or an outbreak in that particular facility. Next slide, please. So that brings us, I guess, to the end. Dr. Beckman, do you have anything you'd like to add just from an overview perspective?
No, thank you, Randy. And I want to certainly thank the media for allowing us this opportunity to connect with you here virtually. And certainly at this point, open up for questions.
Yes, we hope that was helpful. So now we'll open it up for questions. Again, if you've got a question, please use the raise hand function by clicking on the participants icon and then raise hand, so that I can see you have a question. I'll let you know when you are unmuted and on the line. And I just ask that you also include your name and media outlet. That would be very much appreciated. And just to reiterate, our speakers here today are really experts in the response to long-term care facilities. So if you have a question that sort of falls outside the scope of that, I'll just ask you to send it to our general media email box, which is media_info@state.co.us. And our first question today will be from Jennifer Brown. Jennifer, you're on the line.
Hi guys, Jennifer, I'm from the Colorado Sun. And my question is, we've been paying really close attention to the outbreak data that comes out every week and looking at in particular, the nursing home data. And there was a span of a couple weeks there where it was almost, 100 new deaths per week. And that seems to have slowed down pretty significantly, at least the last 2 weeks. So I'm wondering if you could address whether you think that those facilities have turned a corner, perhaps. I'm guessing it's too early to talk about relaxing some of the visitor restrictions and things, but maybe you could just talk about how hopefully that's peaked and is getting better, or if you think that's true.
So this is Randy. Thank you very much. No, that's a great question. I guess I'll start off and then ask Dr. Beckman to add in. The good news is you're absolutely right. We are seeing a decrease in the deaths and the number of cases slowly. I'll say first and foremost, I think it's all part and parcel of flattening the curve. I don't think that we have turned the corner. We all agree and understand that we're in for a long battle with this disease until such time as vaccinations come along. But I think it's a combination of a couple of things. First of all, coming to the understanding of how important testing is has been critical to that. And a lot of that research has really been done here in Colorado with CSU and some of our providers here as well. So that certainly has been helpful to do that. I think in addition, slowly but surely, PPE is becoming more available to the providers that are out there. So again, nothing scientific other than to say that we think it's all part and parcel of flattening the curve. Jeff, would you agree with that?
I would. Thank you, Randy. And really, I think it was just the need for having such a multifaceted approach, from help on the prevention side, help on getting additional education to providers regarding PPE and infection control practices, the real availability of testing, and especially in the early stages of an outbreak, has really been critical, as Randy had referenced before, and identifying folks that were both symptomatic but also asymptomatic carriers, and being able to really collaboratively work with the facilities in cohorting strategies where they could separate the folks that have been exposed and have positive disease from the folks that didn't have illness. And I wish I could say which one of those factors was really the most important in reducing the spread of disease and outbreak, but we essentially approached it on so many different levels. It's hard to really tease out which one was the most effective as we kind of try to look at this broadly to make sure that we had all the gaps covered.
Great. The next question will be from Lindsay Fent.
Hi, this is Lindsay Fent. I'm with CPR News. So on the outbreak list, a lot of the outbreaks are now listed as resolved in nursing homes. And I'm wondering in what exactly that means. And in some cases, does it mean that COVID positive residents are being moved out of facility and into another facility to resolve it? Or does it mean that those people have now recovered?
So this is Randy. Jeff, I'm going to ask you to address that. For those of you, I don't think we mentioned earlier, Dr. Beckman has been assigned down at the Operations Center for the past 3.5 months and has been working much more closely with some of the epidemiologists who are keeping those data. So Jeff, you want to speak to that a little bit?
Certainly, Randy, thanks. So I think it's probably a combination of identifying the folks who were critically ill and needed a higher level of care, and those folks were moved to hospital settings where they can get more hospital acute care. And then other folks with mild symptoms being in a facility and cohorting, so there was no transmission to folks who had not been exposed to really mitigate the spread. And in those scenarios, and really keeping the residents separated from the folks that had illness or had been exposed and not, and then also certainly treating folks that had real more severe disease in hospitals. I think the combination of both of those things, and then seeing overall recovery in the mild to asymptomatic carriers of this illness would be something to that would likely reflect those numbers. But again, I would probably defer most of those details to our hospital acquired infectious teams who have been directly involved in the effort for the mitigation of illness in those facilities.
Yes, so if you have additional questions about that, Lindsay, feel free to send an email to the media_info@state.co.us. The next question will be from Kim Posey, and I'll just let you all know that I don't see any other hands raised after Kim, so if you have a question, go ahead and raise your hand. Kim, you're on the line.
Okay, hi, Kim Posey with Box 31, and I was wondering if you could address the visitor restrictions and how long you think those could be in place or if they would be lifted, and any sort of concerns, do you have any looking forward into the fall?
Well, thank you very much, Kim. This is Randy, and I think that's a great question because we're hearing a lot about that, and we're extremely aware of the negative side of the restrictions that are in place right now in terms of isolation. Again, this is a vulnerable population, and isolation, loneliness, and depression can set in, and we know that that's extremely important to be addressed as soon as possible. So what I will tell you is that the task force presently has worked on and is putting the final touches on some recommendations for Governor Polis and his team in terms of moving into the next stage of what I think over time you're going to hear referred to as phase 2 in allowing some visitations. I believe the governor did mention recently in one of his press conferences a visitation program based on family members passing getting tested and being free and giving them an opportunity to see their loved ones. So despite the many efforts I think that our providers out there have done in trying to provide virtual visits. You know, we've provided a lot of funding for iPads and things like that for facilities during this time. The virtual visits, those are a little bit, but they're not enough. So you will be seeing some changes and adjustments in terms of the public health order over the next. I don't really know how quickly that will or won't happen, but the department and the governor's office are extremely concerned and working very hard on how we move forward in the safest possible way. I think it's important to remind all of us that this is not over, even though the curve has been flattened. And with the populations being served in these facilities, we're concerned because we're probably only going to get one chance to get this right. And so we're working very hard to do that. But change is coming and is nearby.
This next question is from Kathy Walker with KOA News Radio. She put it in the chat, but also raised her hand, I think, having some challenges with audio. But she is wondering, is the state hiring a traveling team to help have people available to back up staff at a facility with an outbreak?
So this is Randy, Cassie. Thank you. That's a good question. So I think what I would say at this particular moment in time, because again the task force is becoming more and more solid in terms of its formation and support. We're not hiring people for the replacement of staff. However, partnerships and contracts and agreements are in place with, for example, staffing agencies. Healthcare policy and financing, you know, has been working for a long time in this area of finding personal care workers and providing additional healthcare workers, because we've had barriers and struggles within the healthcare workforce long before COVID came along, and so this has only exacerbated the problem. So opportunities and abilities for us to connect providers with staffing agencies, with some of the volunteer agencies out there. I know that my co-chair, Bonnie Silva, has been working with a couple of organizations that are actually connecting displaced healthcare workers, folks that may be temporarily displaced when the healthcare system has been down, into these kinds of environments. So we're working on that. We've not moved forward, to my knowledge, with hiring a workforce at the state level. That probably isn't the most efficient way to do it, but we are connecting people and going to do everything we can. And working with the Department of Regulatory Affairs in terms of credentials and allowing people to move their credentials as necessary and quickly to provide care. So those steps are all in place, and that activity is ongoing and moving forward.
All right. Next question will be from Lindsay Fent. And again, looks like there's no other hands raised after Lindsay. So if you have a question, feel free to raise your hand.
Hi, this is Lindsay with CPR News again. So despite some of the early measures that were taken in these facilities, outbreaks were obviously still able to get into many of the facilities. So will this pandemic be spurring any kind of permanent change in these long-term care facilities, even once we have a vaccine and are kind of beyond this?
So Lindsay, this is Randy. I'll take the first shot, then I'll ask Jeff if he has any comment. But I think it absolutely will, without question. You know, it was only 3 years ago, I think three and a half years ago, when the Centers for Medicare and Medicaid Services added to its requirements and regulations for all of these facilities to develop and build emergency response plans. And those plans were done, and facilities came into that. Well, I think we all thought like the typical things we think about here in Colorado, which are wildfires and floods and the kinds of things that can happen that we in Colorado deal with on an ongoing and regular basis. I don't think any of us actually thought about and gave serious thought to a pandemic, and certainly not something of this magnitude and nature. I would venture to say that the isolation plans that Governor Polis ordered these facilities to pull together have been a real learning experience for them as well as for us. I would look forward, I would suspect that we will see that type of planning continue moving forward. I think this will be another one of those disasters that, if any good comes from it, it is the opportunity to be better prepared for this and similar events moving forward into the future. I think we'll see that unfold over the next period of time at such time as we are able to win the current battles that we're fighting.
And Jeff Beckman here. Yeah, just to add what Randy said, I think, this type of pandemic has really reinforced and again, just articulate what he said before, the importance of really good preparedness plans, infection control plans. Then also what it has opened up is technology-based healthcare, which has, certainly, I think, changed our healthcare system for the future, and using technology and virtual applications to really enhance not only healthcare for residents and patients, but also connectivity to family, both near and far.
Great. Are there any other questions? I don't see any hands raised at this moment. Lindsay, you're on the line.
Sorry to be dominating this so much, but this is PPE, you've mentioned that it's gotten easier to get PPE. Are there still nursing homes with significant shortages of PPE?
So this is Randy. Yes, I think there are still facilities that are struggling with, and actually, making those connections, particularly our smaller facilities out there that don't have the connections and purchasing power of, for example, some of the large corporations that are in the industry have continued to struggle. I can tell you from our own division's perspective, we continue to work hard at having enough PPE to protect our staff that are out doing the inspection work right now. So it is not by any stretch of the imagination plentiful just yet. I think the other component to that, Lindsay, to keep in mind is the burn rate, or the rate at which a facility goes through the gowns, the masks, the gloves, is greatly increased in this kind of environment where facilities are caregivers are changing, having to change that out on a fairly quick basis. So that again contributes to the problem. So those issues are still there. The struggles continue. It isn't hugely plentiful. It is much better than I would suggest that it was 6 weeks ago. And we hope that, along with everything else, as in the supplies for testing and things like that, that the supplies become a little bit more plentiful. And Jeff, I don't know, have you all have looked at it from the SEOC's perspective, or do you get any sense of it getting better quick or slow?
No, thanks, Randy. So at the CDOC, we've been incorporating some of our long-term care facilities in our situational awareness reporting. We use a web-based system called EM Resource. So we've been trying to use technology to identify real-time shortages where facilities would be able to notify, and then help use our strategic national stockpile of sources to help assist with PPE. Overall, shortages are still there, but certainly, as Randy had alluded to before, we are seeing better availability for the key items, which would be gowns, gloves, and masks. But still, certainly acquiring those continues to be a challenge as we have hospitals, we have long-term care facilities, we have EMS agencies, state agencies, businesses, really all competing for the same PPE availability that's out there.
Great. This question will be from Kim Posey.
Hi, Kim Posey again from Fox 31. I don't have this week's numbers on the nursing homes in front of me, but I was wondering if there was a way one of you could just give a direct comparison right now to, say, 6 weeks ago, and just what do you think that shows?
So this is Randy. I'll take the first stab at it and then ask for Jeff to maybe look at it from where he's at. I don't have the numbers in front of me either, Kim, but what I do know is that in terms of the quote unquote new outbreaks, we have been seeing a decline, a steady decline. Again, it's part of flattening the curve, and that makes us feel better, although still certainly guarded from that standpoint. Again, we're not out of the woods yet. The disease is still active in the facilities, and so I guess I would suggest that that is the dose of caution that we are continuing to move forward with to see that we keep that suppression. And I apologize. I know that's probably not the solid kind of answer you'd look for, but we do feel like we're making progress. And I think as we learn more about the disease, coupled with the resources to fight it and to support the facilities, coupled with the continued improvement we hope in terms of both PPE as well as testing supplies, and we can get comprehensive testing programs into these facilities, I think that hopefully we will continue to see that decline to go with it and an improvement in the conditions within our long-term care facilities. Jeff, do you have anything to add to that?
No, Randy, I think you articulated that well, and I think just to reemphasize a point of not being out of the woods yet, and though that we're seeing declining cases overall, we are still seeing new cases. So I think it's important not to let the guard down, so we don't have a reversal of all the efforts and all the interventions we've done to mitigate it to this point.
All right. I think we are getting here to the end of our time. So I'll have this be one last time to raise a hand for questions. Give it just a moment. All right. So I see one more question from Lindsay and one from Kim, and then I think we'll be right here up about at the end of our time. Lindsay, you're on the line.
Hi again. Could you guys just explain a little bit more about what the isolation plans were and what they did? Was each facility responsible for being able to isolate positive residents within their own facility, or did the state provide some kind of off-site isolation areas?
So I could take this, Jeff Beckman here. So that's a great question. So really the first efforts that were done is to have an epidemiology team work with the facility to see what the ability would be to cohort, and cohorting, getting residents who have been exposed or who have become positive with disease separated from others. So really, there were a lot of efforts to keep residents within their facility if that could be done in a very safe and effective manner. And a lot of that was done from extraordinary work from our state epidemiology teams, and also in collaboration with a lot of the local public health agencies who are also working in collaboration with the state teams.
Randy, is there anything you wanted to add to that?
No, and my apologies. I somehow got muted and couldn't get unmuted there. And if I understood the question correctly, did we provide any offsite or additional locations? We were not put in a position to have to do that. The additional facilities and expansive resources that have been put together have not, we've not been forced to use them yet. I think that that's a pretty good thing.
All right, and Kim, you're on the line again.
Okay, thanks so much. Back to the possible easing of visitor restrictions. You had mentioned the governor's plan might involve testing. I was wondering if you could lay out what that would look like. Would somebody be tested at the nursing home and wait for results there, or how, or would they have to prove that they've been tested within a certain amount of time? What would that look like?
Well, I appreciate the question very much, and I cannot speculate very much on it just yet. But I think there are a variety of strategies that we can put in place that are being considered by the task force. I think that particular one would be looking at the opportunity for family members and loved ones to go to one of the many testing sites that we have here in Colorado and those that are being added and take be tested. And when they receive the results of those tests, be given a window of opportunity to come into facilities and come into the facility and see their loved one. I think that's kind of the overall logic behind that. There are other models as well. So again, I hesitate to speculate too much until the governor's office has an opportunity to review the options and we look at the data and make sure that we do this right.
Thank you. All right. With that, I think we're going to go ahead and wrap it up. So we thank you all for joining us here this morning. We hope this was helpful, that it was able to answer some of your questions. Again, our speakers were Randy Kirkendall, Director of the Health Facilities and EMS Division at CDPHE, and Dr. Jeff Beckman, who is the Associate Division Director of Health Facilities and Emergency Management Division. He's in the EMTS Enforcement and Medical Director for the division as well with CDPHE. So thanks again for joining us, and I hope you have a great afternoon.
Thank you all.
Thank you all.